Good evening, everyone. I am Shauradip Odhikari, and it's with great pleasure and honor that I welcome you all to today's insightful webinar, Basic Concepts of Oxygenation, presented by Modok Trainer Academy. Today, we are gathered here to explore a topic that is not only scientifically significant but also essential for understanding the very foundation of life, oxygenation. Now, I'd like to share a few words with all of you about our today's eminent speaker. Today, we are privileged to have with us an eminent speaker, Professor Nibedita Ghosh, whose expertise in the field of nursing and healthcare is truly commendable. With a master's degree in nursing, specializing in medical surgical nursing, and 9 years of teaching experience in a private nursing college under the West Bengal University of Health Sciences, she has made remarkable contributions to the field of medical education. As a former associate professor at Apollo College of Nursing, Kolkata, she has mentored and guided numerous students, shaping the future of healthcare professionals. Her vast knowledge and experience will undoubtedly provide us with deep insights into the importance of oxygenation, a critical aspect of patient care and medical science. Whether you are a healthcare professional, a student, or simply an enthusiast eager to expand your knowledge, today's session promises to be enriching and valuable. So, without any delay, let's extend a warm welcome to our today's eminent speaker, Professor Nibedita Ghosh, and begin this valuable session. Thank you all for being here, and let's make this webinar a memorable and enlightening experience. Now, I humbly request to our today's eminent speaker, Professor Nibedita Ghosh, to start her valuable lecture. Over to you, madam. Thank you.
Thank you. Thank you very much for this warm welcome. Let me share my screen. Slides are visible?
No, ma'am.
Just give me 1 minute. Now it is visible?
Yes, ma'am.
Okay, let's start.
Ma'am, can you please turn on your video?
Okay, 1 minute. Is it okay?
Yes, ma'am.
Okay. So today our topic of discussion is basic concepts of oxygenation. This is the outline of today's session. Let's start it. Before going to the main topic, we will review the anatomy of the respiratory system. We all know the primary purpose of respiratory system is gas exchange. This involves transfer of oxygen and carbon dioxide between the atmosphere and blood. Respiratory system is divided into two parts: upper respiratory system, upper respiratory tract and lower respiratory tract. And the upper respiratory tract includes, you can see in the picture, the nose, mouth, pharynx, epiglottis, larynx, these parts coming under the upper respiratory tract. And the lower respiratory tract includes trachea, bronchi, bronchus, bronchioles, lungs, alveoli, these parts. Next, coming to the alveoli. What is alveoli? Lung is characterized by the presence of numerous thin-walled alveoli. These alveoli are just like a balloon. And the balloon has a tendency to collapse, that we know. Alveolar sacs also have a tendency to collapse. That's why the alveolar cells secrete surfactant which prevent the alveoli from collapsing. And the gaseous exchange takes place through capillary wall and alveolar cell membranes. Gases diffuses from higher concentration to lower concentration, that we know. And in the lung, oxygen concentration is more, letting it diffuse into the blood through the capillary wall. And the oxygenated blood from here, it carried to the heart to be distributed to all of the tissues of the body. And this mechanism, the mechanism of respiration, is controlled by a respiratory center, which is situated in our brain. The medulla is the respiratory center. So next, we are going to the next slide. Now we have to know what is oxygen. That we all know that oxygen is a colorless, odorless, tasteless gas that is essential for the body to function properly and to survive. Now the question comes, what is oxygenation? Oxygenation is the delivery of oxygen to the body, tissues and cells. Or we can say oxygenation is the molecular absorbance of oxygen. Let it discuss in a simple way. When we breathe, air enters the lungs and the oxygen is picked up in the hemoglobin by red blood cells. In previous slide, we have already discussed that the gaseous exchange performed between the alveolar cell walls and capillary walls. From there, and in the blood, there is red blood cells, and in the red blood cells, there are hemoglobin. Hemoglobin picked up this oxygens, and so it can be transported and distributed to the tissues of the body with the help of the heart, because heart pumps the blood to all over the body. And all of the organs in our body, human body, requires a certain amount of oxygen to function properly. It is a nutrition of the cells. Next, the term is oxygen saturation. You may have also heard the term oxygen saturation. At the time of COVID, we all get familiar to this word. Oxygen saturation, or SpO2. What is this? This is the amount of oxygen found in our arterial blood. Normal level of SpO2 is 95 to 100%. When this oxygen saturation falls below 90%, we say that the SpO2 is low, or this patient having low saturation. And this condition is known as hypoxemia. And whenever the hypoxemia is present, the organs of our bodies will not get enough oxygen as per their demand. So the tissues will get low oxygen, and this condition is known as hypoxia. And whenever this hypoxemia is present, this is when the oxygen therapy is indicated in order to increase the levels of oxygen in the blood. So now we are coming to the next terminology, that is oxygen therapy. Oxygen therapy is a treatment in which the patient is provided with extra oxygen to breathe. It is also called a supplemental oxygen. And when we breathe, the air that we breathe, it contains approximately 21% oxygen. So whenever in the case of hypoxemia, we are giving supplemental oxygen, that is more than this 21%. Okay. And the hypoxia, in hypoxia, when the oxygen level is low in the tissues, the signs may include the breathing difficulty, dizziness, headache, weakness, confusion, or bluish discoloration to the skin, that is in the nail beds, tip of the nose, or in the earlobes, and chest pain. These signs may be seen. Next is the oxygen is a prescribed drug. So medication is a therapeutic agent. Like that, oxygen is a therapeutic agent. So there should be written prescription for oxygen administration. And in the prescription, physician should mention the flow rate, concentration, which device to be used to administer oxygen, and the duration of therapy. Next is the sources of oxygen. Here we can see there are two pictures. First one is oxygen cylinder. It is very familiar to all of us. And the second one is the oxygen wall outlet. In case of hospitals, in inpatients or in the wards, we can see this oxygen wall outlets. In the hospitals, there are oxygen plants. And from oxygen plant, through centralized channel, oxygen is delivered to each unit of the hospital. And these outlets are the terminal unit of this gas pipeline system. From here, through a mask or a nasal cannula or whatever device we are using, through this, patient will get oxygen. And this oxygen cylinders generally used while transporting patients, or in case of home oxygen administration, the portable oxygen cylinders are used. In both of these pictures, we can see there are a bottle-like structure. It is known as humidifier. Humidifier is used for humidification of oxygen. These humidifiers are filled with sterile water. This humidification of oxygen is necessary because dry oxygen, if we administer dry oxygen, it can irritate the mucous membrane. So that's why the humidified oxygen should be administered. And there are a regulator is there, and this is known as the flow meter. Just above the humidifier, there is a flow meter. This flow meter is a regulator. It controls the flow rate of the oxygen. The unit of the flow rate is liters per minute. Next, coming to the oxygen delivery devices. How the patient will get oxygen? They will get oxygen with the help of some devices. We can categorize these devices into two categories. First is low flow system, and another one is the high flow system. The low flow system is also known as variable performance system, and high flow system is also known as fixed performance system. The low flow system generally varies to 1 to 15 liters per minute, and the high flow system generally 50 to 60 liters per minute oxygen can be delivered. And the low flow system is known as variable performance because it provides the relatively stable FiO2 level in patient whose respiratory rate and pattern are stable. It provides the FiO2 that varies. What is FiO2? FiO2 is the fraction of inspired oxygen. That is the 91% that we already learned in previous slide, that the fraction of oxygen in the inspired air that when we breathe, we inhale the 21% oxygen. That is the FiO2 or fraction of inspired oxygen. And in case of high flow system, it is a fixed performance system because here the FiO2 is stable, and high flow system delivered accurate oxygen concentration at flow rates that meet or exceed patient's own inspiratory flow requirement. These are some examples of low flow device and high flow device. The nasal cannula or nasal probe or simple oxygen masks, these are very common, we all know. And other than this, there are various devices like partial rebreather mask, non-rebreather mask, venturi mask, or high flow nasal cannula. These all are the very common devices for oxygen delivery. Next, coming to the devices used in case of pediatrics. In case of pediatrics, the small babies often cannot tolerate this oxygen mask or oxygen cannula, these things. For those babies or those patients, pediatric patients, we can use the oxygen hood. You can see it in the picture. It is a rigid plastic dome that encloses on baby's head, and it provides a precise oxygen levels and high humidity. Another one is the oxygen tent. It is made up of a rectangular clear plastic canopy. It's a tent-like structure with outlets that connect to an oxygen source. And it can also be used for adult patients who are unable to tolerate mask for extended periods. Next, coming to another device, that is the oxygen concentrator. The patients who needs home oxygen administration, for that patients, physicians often prescribe these oxygen concentrators. An oxygen concentrator is a medical device that gives extra oxygen, but it is different from oxygen cylinders. Oxygen cylinders stores oxygen, and from oxygen cylinder through oxygen mask, the patient is getting, or a person is getting, oxygen as per his or her prescribed flow rate. But this oxygen concentrators uses the air around us. It uses the air around you to make oxygen. The machine pulls air in through a filter and into an air compressor, and more filters trap nitrogen and let the oxygen through where it is collected in a tank. And it gives you air that is 90 to 95% oxygen. So it is trapping, it is filtering the air and collecting the oxygen in another tank, and in a separate tank, and from there it is giving 90 to 95% of oxygen to a person. Patients who needs constant oxygen at home, for those patients, this oxygen concentrator is prescribed. Like a patient with asthma, patient with chronic obstructive pulmonary disease, patient with bronchitis, or a patient with sleep apnea. These patients can use these oxygen concentrators as per their doctor's advice. Next, coming to the hazards of oxygen inhalation. First is infection. Infection may occur because of use of contaminated equipments which are used in oxygen administration. Next is combustion. As we know, oxygen is a combustible substance, so fire is a potential hazard when oxygen is administered. Next is drying mucous membrane and respiratory tract. If oxygen is administered without sufficient humidity, it causes drying and irritation of mucous membrane. That's why humidification is necessary. Next one is oxygen toxicity. It is a condition which occurs due to inspiration of high concentration of oxygen for prolonged period of time. And the signs symptoms of oxygen toxicity may be the dryness and irritation of mucous membrane, tracheal irritation, cough, chest pain, nausea, vomiting, or shortness of breath, like this. Next one is the atelectasis. Atelectasis is a condition where the alveolar sacs depleted. Okay, so increased oxygen concentration in the inspired air leads to depletion of nitrogen, and nitrogen helps the alveoli to expand. So because of this depletion of nitrogen, deflation of air sacs can occur. Next is oxygen-induced apnea. Apnea, the word apnea means absence of respiration or cessation of respiration. Because if a patient is getting high concentration of oxygen, the carbon dioxide is washed off completely very fast. There is a complete washed off of carbon dioxide from the blood. And because of this complete washing off of carbon dioxide, the respiratory center is not stimulated sufficiently. And because of this insufficient stimulation, the signals will not come properly, which leads to cessation of respiration. One minute. Next is retrolental fibroplasia. Oxygen therapy may affect the eyes, especially in infants or babies, because high concentration of oxygen develop fibrotic changes behind the lens. Fibrotic changes means a pathological process that causes tissue to thicken and harden. And because of this thickened and hardened tissues behind the lens, it will impair the light penetration to retina. This condition may occur in case of small babies where hood is using or tent is using like this. Next, coming to the responsibilities during oxygen administration. Oxygen is a therapeutic gas that we already discussed and must be prescribed by physician. Before oxygen administration, we should check the physician's order. And while a person is getting oxygen, supplemental oxygen, we should always assess patient's breathing pattern, the respiratory rate, and the continuous monitoring of oxygen saturation. Check that oxygen is properly humidified, because if it is not properly humidified, it will irritate the mucous membrane of the mouth, nose, and the respiratory tract. To prevent dryness, provide emollient to the nose tips and in the lips, and to provide the arrangement for mouthwash, because there is a chance of dryness of the mucous membrane. So frequent mouthwash will give relief to the patient. Sterile equipment should be used to prevent infection, and the sterility is important, and also the hand hygiene is important. Whenever we are handling this equipment, before that, we should maintain hand hygiene, hand washing. Next, assess the skin attached to the mask or over the ears or nostrils, because there is a chance of skin breakdown due to friction. Oxygen is highly combustible gas. It can easily cause a fire in patient's room if it contacts the spark from an open flame or electrical equipment. For that, place an oxygen in use sign on the door of the patient's room. Smoking should not be allowed on the premises, and determine that all electrical equipment in the room is functioning correctly. And when using the oxygen cylinder, secure them at upright position, tie it with chain, or use the appropriate cylinder holders like this. Check the oxygen level of potable tanks before transporting a patient to ensure that there is enough oxygen in the tank. Monitor patient frequently to check the placement of the mask. Check frequently that both Prongs are in patient nares in case of nasal cannula. Pay attention to the kinks in tubing or loose connections and faulty humidifying apparatus, and it may interfere with flow of oxygen. And monitor for oxygen toxicity. So these are the responsibilities, basic responsibilities when a patient is getting supplemental oxygen. Now, the self-care behaviors for promoting oxygenation. So how we can promote our oxygenation? Follow a regular exercise for 30 to 45 minutes, a free hand exercise, maintain normal body weight, perform deep breathing exercise. Deep breathing exercise can increase the muscle strength of our respiratory muscle strength. So we can do deep breathing exercise anywhere, but we have to keep in mind that we should sit by keeping our back straight. And whenever we are doing deep breathing exercise, place one hand on your chest and another on your abdomen. Inhale slowly and deeply through your nose, just like you are taking a smell of a rose. And then hold it for 10 seconds. Inhale slowly and deeply through your nose and then hold it for 10 seconds. Count in your mind 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then exhale slowly through your mouth by pursed lip. What is pursed lip? Exhale slowly, just like you are blowing a candle. Okay, we can do this deep breathing exercise regularly, just for a 5 to 10 minutes a day. Then obtain medical evaluation for any chest pain or problems with breathing or chronic cough or cough with sputum or blood like this. Next, incorporate a plan to reduce smoking and then stop smoking on a specific target date. Avoid exposure to secondhand smoke when possible. Maintain proper hydration because proper hydration can liquefy any congestion in the lungs. Use mask in polluted areas and support the community effort to keep the air free of pollution. So this is about the basic concepts of oxygenation. Thank you.